much, Madam Chairwoman and Ranking Member Graves, for holding this hearing today on a topic that is so critical to my district and indeed to our nation. As Congress works to finalize the FY 2010 budget, we must closely examine Medicare and Medicaid. The Obama administration proposes changes to these programs that may impact small health care providers in the success of health care reform. Medicare and Medicaid are nationwide programs that provide health care coverage for over 43 million elderly and disabled Americans. These programs, particularly Medicaid, is vital to many low-income New Yorkers, I'm a New Yorker, who rely on this program for primary care. The examination of the President's budget proposal and how it may impact small health care providers is an imperative for the success of our emerging health care delivery system and the growth of its economic viability within our local communities. My first question is to Dr. Harris. You stated in your testimony that the Institute of Medicine reported that additional primary care physicians are now needed to meet the demand currently underserved areas. I just learned that in total, over 1.9 million Medicaid enrollees currently live in areas with inadequate access to primary care physicians, including Flatbush, Brooklyn, which is located in my district. As a matter of public policy, what do you think that Congress should consider to address the currently underlying shortage in available primary care resources, and what could we do to attract these physicians to underserved areas?
Madam Clarke, as you suggest, there is a shortage now, even with 46 million uninsured people. We're 16,000 short, according to the Institute of Medicine. And the Health Affairs projects it's going to be a 40,000 shortage. That's even allowing for the nursing issue. So it is an enormous issue. I think two things come to mind. One, part of the patient-centered medical home demonstration projects has to do with Medicaid. As I recall, there are 25 states in the United States which are now trying Medicaid demonstration projects to see if the patient-centered medical home concept can help reduce the cost and improve the quality for those who are on Medicaid in those 25 states. The second issue gets to your point of the distribution of physicians. A very difficult issue. I mean, the practical one that one can do now, we understand that Congresswoman Allison Swartz, I believe, is introducing legislation that will propose loan forgiveness for kids of about $30,000, $35,000 a year to help overcome their debts from medical school in exchange for time that they will spend in underserved areas. What the college would say and encourage you is when you're defining these underserved areas, think about primary care undefined areas, not all physician, because that truly, as in your district, is where the need is so utterly acute.
Can you, Dr. Harris, can you determine how primary care physician availability may be affected by possible hospital closures? Do you know if most area hospitals can accommodate displaced ambulatory care resulting from a reduction in primary care? No. I mean, you would have two dreadful things happening simultaneously. You would have a shortage of the primary care physicians who ostensibly could follow people in an outpatient setting and provide preventive care, their acute illnesses, their long-term chronic care. Then you would have the hospitals, to which many of them now turned, absent a primary care physician, particularly for the acute care. So it would simply compound the problem. But, at the risk of beating a dead horse, we believe the rate-limiting factor, and if I can add, if I may, for the committee, just parenthetically, the American College of Physicians championing this notion of primary care is not as self-serving as it sounds. Half of our membership are subspecialists. This is a difficult message we have to convey to them. But we have tried to do it in an objective fashion, and the data, again, in this country and overseas, utterly compelling that the best way to reduce cost and improve quality coast to coast is trying to get our 30% of that workforce up closer to the 50%, as all those other 12 countries have, which have everything so much less expensively than we do and with better outcomes than we do.
Thank you very much, Madam Thayer. Thank you to all of you for your testimony today. It's been quite compelling, and I'm sure we'll be relying on your expertise going forward as we look at what we do with our healthcare system, for the 21st century. Thank you very much, gentlemen.